Cardiac MRI is a form of non invasive cardiac imaging that uses a magnetic field and radio waves to image the cardiovascular system. In the Pediatric and Congenital Heart Center, we typically image children with heart disease or suspected heart disease and adults with congenital heart disease. Echocardiography is often the first step in non invasive cardiac imaging, but cardiac MRI offers certain benefits. Not only are we able to evaluate the cardiovascular anatomy, we can evaluate the cardiac function, blood flow through certain vessels, and unique among imaging modalities, we can actually evaluate the tissue character. And in particular, we can look at scar and inflammation within the myocardium. And for that reason, cardiac MRI is very useful in patients with complex congenital heart disease, in patients with myocarditis or suspected cardiomyopathy, and in patients who may need to undergo cardiac surgery or cardiac interventions. So, in the Pediatric and Congenital Heart Center, we perform cardiac MRI in patients of all ages, including infants and children with heart disease and adults with congenital heart disease. For children undergoing cardiac MRI, we have some additional supports. We have child life specialists who help prepare the patients for cardiac MRI. And in addition, a support member, such as a family member, can actually be in the scanner room with the patient. Typically, patients under age 8 need sedation, which is provided through our pediatric anesthesiology or pediatric cardiac anesthesiology service. But we have been able to perform unsedated and awake cardiac MRI studies in patients as young as 6. The procedure itself is not painful. However, many times we'll give contrast through an IV, and the IV placement can be uncomfortable. We do have numbing sprays and creams to help reduce that discomfort. The study itself can take anywhere from 30 to 60 minutes, depending on the complexity of the cardiac anatomy. However, we do ask patients to come 1 hour beforehand to prepare for the MRI. For the vast majority of medical implants, a patient can safely undergo a cardiac MRI, and that includes implantable pacemakers or cardiac defibrillators. In fact, a lot of the research on scanning patients safely with those implants was done right here at Johns Hopkins. And so we have an excellent track record and standard protocols for scanning those patients. For pediatric and congenital cardiac MRI studies, we have a team of specially trained cardiac MRI technicians with experience in scanning children and adults with congenital heart disease. In addition, a pediatric cardiologist supervises the study in real time and interprets the study afterwards. Cardiac MRI is generally very safe. We have standardized safety protocols, and the cardiac MRI technicians are in constant communication with the patient and the scanner to ensure they have no symptoms or discomfort.